sense. What are good treatment options or support for rejection sensitivity? So that's actually a term I have not heard in specific. So if the question asker wants to add more context to that question, that would be awesome. I'm going to take a wild guess at what it means for rejection sensitivity. And while I talk, I'll see if there's further clarification. So I'm taking rejection sensitivity to mean that something happened. So a person wanted something to happen, especially when it comes to either friendships, like relationships, romantic relationships, or platonic relationships. And the person reached out and did not get the response that they expected. And that can happen to basically anybody. It can happen to kids. It can happen to adults. And depending on, it's really funny. Human beings are layers of things. So the first layer is your temperament. And if you ever talk to a pediatrician, literally, ask them, hey, what does temperament mean? Because I'm a trained pediatrician, and talking to you about childhood development, temperament is kind of the first little nugget of who you are. And then you get to overlay other things like personality, and personality is kind of the traits that you use to see the world and understand the world. And so certain people have certain ways of seeing the world, some that are more kind of sensitive than others. And so when they put their heart out there, when they put their feelings out there, it can be, and you take that risk. Some folks aren't necessarily always prepared for the result. And so one of the ways to improve your rejection sensitivity is to acknowledge, number one, you're human. And this goes even for itty bitty. So like if you're talking to a kid, it's very much validating them and saying, hey, you are a great person. It didn't work out this time, but it doesn't mean that it won't work out at some time. And it just depends. Depending on your age, certain rejections will have certain effects. So like teenagers who get rejected by other teenagers, it's a big deal. Like they take it hard. Or if you have a boyfriend or a girlfriend at that age, it's super intense because teenagers feel things so strongly. Whereas, 6 and 7-year-olds, if some of their friends don't want to play with them, some kids are just like, okay, I don't care. Whereas other kids are very much, kind of distraught, but not as much as a teenager. And so just kind of working through who you are, and especially having a really supportive network around you to remind you that you are worthy and wonderful and that things will work out at some point, whether it's a platonic relationship or a romantic relationship. That's the best way, in a sense. The short answer is, keep on working through it, keep on trying. And over time, you will develop those coping skills to recognize and to start to feel better. So the clarification, my kiddo has ADHD and is very quick to have a heightened response to anything he feels is critical or rejection. Amen. It seems like one of the dominant characteristics of his ADHD. And it's really funny. So technically, it's not supposed to be part of the ADHD paradigm, but I've heard that before. So you are not alone in that statement. I would throw in there some of it is a little bit of personality. So, and personality is not a bad thing. Everybody has a different personality, and personality is wonderful. And some of my favorite kiddos to work with, I call them sweethearts. And these are the kids that really wear their feelings on their sleeves. And because we live in the society that we live in, this society generally supports and celebrates extroverts, and which means that all of my little introverted, sweethearted kids oftentimes get overlooked or not appreciated. And so just reminding those sweethearted kids that they are appreciated and that they're loved is super helpful. The part where the ADHD comes in is because their brains are going so fast. A lot of time there's no time between thought and action. So if they get rejected, instead of going, well, dude, that sucks, let me take a moment and go, oh, yeah, the world is okay. They don't do that because they go from that sucks to, oh my God, I'm going to scream at you or whatever. And so, I can see where the ADHD can kind of cause a shortened time between getting rejected and reacting. But you can treat it all the same way, which is validate and sometimes just, yeah, if they need to get their feelings out, and as long as they do it safely, that's totally fine. And just know that it will get better. So even for that impulsiveness, that part is going to get better as they get older and mature, and their frontal lobe adds more layers to it. So.